Right now, we are going to talk about e-health as one of the priorities of the European Union. New opportunities for Europe, new opportunities for Poland. When at the beginning of the pandemic, you probably remember that in terms of healthcare, European integration does not look very well. We had our ups and downs. Well, initially, some countries more, some countries less, held a grudge to the EU that it's not helping. And suddenly everyone realized that it's up to member states which deprived the Commission of certain competencies and other European institutions. And suddenly we have woken up and realized we have to give them back to the Commission, and health has grown to become one of the main areas of interest and integration in the EU. But that ties to challenges brought on by digitization, because it's about implementing and maintaining unified standards. If we want everything to work smoothly within the EU, we need to have uniform legal regulations, for example, on protection of patients' data. And it's not only a matter of merging data sets over the borders. Those data sets must be identical in each and every state in order for different institutions to communicate on the state level instead of with each other. Well, in fact, health is one of the fundamental European values. It's a central value related to how we treat each other as human beings. We have liquidated barriers and borders, but besides treaties, health becomes one of the central areas of integration. So the EU has defined a number of priorities. The new Green Deal is one of the pivotal ones alongside health. So I think this area defined itself. Well, faced by the need, the response to the need, for example, transferring patients from one country to another, I think for the first time ever, we've seen it in France. Some COVID patients from France were moved to German hospitals, and this was followed by regulations because, life is faster. Life goes beyond our expectations. We can't prepare for developments, but right now we are catching up. So participants of the next session include keynote speakers who will give us a short introduction: Artur Pruszko, the CEO of Polpharma Group, and Kazimierz Cięciak, Consulting Director of Comarch. And comments and discussion presents Lubisław Matejewicz, CEO of Preventicus Managed Care, Paweł Mańdok, the president of Aqua Healthcare Poland, and Robert Mołtach, the co-founder of Health and Democracy Institute. And again, so first of all, our keynote speakers, followed by brief presentations.
Dzień dobry, and thank you for having me today. I'm very happy to join Forum eZdrowia, and I see very interesting topics on the agenda and great speakers, and I really believe that all together we can make a difference. The COVID-19 pandemic showed us how a healthcare system crisis can lead us into social and economic crises as well. But I think that thanks to joint forces of healthcare professionals, governments, the pharma industry and many others, we can emerge even stronger from this crisis. So thank you all for your efforts. We can observe that one element that really helps us in this context is the digital transformation of healthcare and the pharma industry. Digital health is also one of the EU priorities. That is why today I'd like to talk about new opportunities for Europe, new opportunities for Poland. We're currently in a very difficult but at the same time interesting moment due to the digital transformation of the healthcare and pharma industry model. I believe that everyone has the right to have access to safe healthcare at a high quality. This is a fundamental human right. But at the same time, we are faced with challenges all over the world that do not allow us to fully implement this right in practice. I'm thinking here about growing and aging populations, chronic disease outbreaks, increasing costs, staff shortages, and also the COVID-19 pandemic. Taking into account all these factors, I see that digital transformation of the whole healthcare system as a real and efficient solution to some of these pain points. And actually, it's not only me who sees the importance of digital health. Let's have a quick look into the WHO, the EU, and the German policy papers, which show trends and priorities in public healthcare and digital health. WHO has published a global strategy on digital health 2025. The final version of this policy was announced during the 73rd World Health Assembly. In the European Union, the digital single market strategy was announced 2018. But we have a lot of initiatives on a European level. Just to mention a few of them: the EU pharmaceutical strategy, the European health data space, EU 1 million genomes, or exchange of cross-border information with e-prescription and patient summary. The German government published a very interesting Global Health Strategy 2020 to 2030. This paper was announced on October 19th, so just a few weeks ago. I chose this policy as an example of a national strategy because it presents a holistic approach to the government, to the environment, climate change, and public health in a very interesting way. This paper is also consistent with the WHO and the EU agendas. So what about Poland? We can see that states are increasingly committed to defining coherent public health and pharma priorities at the European level. I'm very positive about selected initiatives made by the Polish government bodies and the Ministry of Health in terms of e-health solutions, e-prescriptions, e-sick leave or e-referral, which will be implemented in January 2021. We are waiting for the new healthcare system development strategy because we believe that we really need a more comprehensive approach to digital health and the pharmaceutical industry in Poland. We see various bottom-up initiatives from the level of business or associations, but we need a strong dialogue with the government. I'm there personally very proud of initiatives made by us through Digital Poland, where Polpharma is a founding member. Now, what do all these strategies have in common? I went very quickly through the WHO, EU, as well as national strategies re e-health and public health. For me, the most important thing is that we can find one common line across them. Do you know what do they have in common? 3 points: prevention, patient centricity, and collaboration. Still, the healthcare industry is focused on treating illnesses. It's not yet ideal from a patient and not effective from a payer perspective. But it seems that in the new reality, during and after the COVID-19 pandemic, not only governmental institutions, but also individuals will attach even more importance to preventive measures. Seeing these actions as a chance not only for well-being, but also as a tool to avoid serious health and economic consequences. Furthermore, the introduction of digital tools on a larger scale in many countries, like telemedicine with well-being advice, applications regarding prevention of contamination and health parameters monitoring can rebuild our everyday reality and healthcare provider system. Historically, public health bodies have dealt with populations as a whole. Nowadays, the approach has changed, and we're not talking about a one-size-fits-all attitude. The power of predictive and pre-symptomatic prevention comes from empowering citizens to look at their well-being from their own perspective. It opens plenty of doors to make positive changes in citizens' lives, in different ways, not as we have done so far. This approach also works very well with new movements in health insurance systems to pay for performance systems, as you see in the United States and the United Kingdom. Payers are increasingly focusing on models rewarding results and maintaining health rather than sick care. Data and digital technologies can help governments to identify groups at risks and change behaviors of people before they become patients. From the perspective of pharmaceutical producers, we can expect that a personalized approach will mean not only personalized care, but also personalized prevention and public health. We can also find very interesting data in the PricewaterhouseCoopers report, Driving the Future of Health. It was published in 2019, so before the COVID-19 pandemic. But I believe that COVID-19 even triggers the trends prescribed in this report. PricewaterhouseCoopers asked 120 C-level executives from global biopharma companies how they estimate the global healthcare budget in 2030. What are the findings? The global healthcare budgets will be under higher pressure, only 10% growing in 2018 to 2030 by 10%, with an increasing role of prevention, which should be 9% of the total healthcare budgets in 2030, and digital health seen as 8% of those budgets. These new value pools will also redefine other segments of healthcare, like care and medication. As I said before, in terms of spendings on medications, governments will more often look for personalized medicines as well as early stage and generic drugs for more manageable conditions. Also due to the significant growth in patients with access to healthcare, spendings per patient, including medications, will fall, with an increasing role of preventive tools. Being a branded off-patent drugs producer, we want to increase access to medicines and increase people's quality of life. This is why I think it is important to put a renewed emphasis to accompany the patient during the whole patient journey and switch from a pure treatment approach into comprehensive solutions in every phase. I believe that understanding the patient journey and driving the pain points can drive the development of meaningful solutions for the patient. Such an approach leads to patient centricity. Why so? Let's see what kind of features will a patient of the future have. He will be well informed, he will get anywhere care, he can exercise control, and he's more independent and is more focused on prevention. This will give a patient more power to exercise control of his and their health during the whole patient journey. Also, patient centricity is often used as a buzzword. But what does it really mean for us in the pharma industry in practice? I think we need to understand the patient needs better to deliver more personalized solutions. I truly believe that in combining medication with digitally supported treatments, we can deliver more personalized value for our patients. To act fast and be effective to answer those big challenges I mentioned at the beginning, we cannot do this by our own. The future of the healthcare pharma industries is in collaboration and partnerships between different stakeholders. There are different areas where we can work together, but I want to focus just on two of them: interoperability and patient data. With the growing amount of applications of digital technologies in healthcare, one of the major challenges for all healthcare stakeholders is to ensure interoperability between different digital and human activities that ultimately deliver the best outcome for the patient. It is critical for synergistic management of information. In particular, rational management of medicine supplies to avoid shortages could be applied once we have broader information on stocks and geographical gaps in provision. Along with technology, interoperability is constantly improving and adapting to match the growth of technology in the healthcare sector. Patients may have a number of specialists and other healthcare options, which means providers need to be able to successfully transfer that data in real time for peak care. While seamless data flows are the foundation of interoperability, it goes beyond just data exchange. Interoperability is also crucial on the level of harmonization and interconnection of various healthcare services. A clear view for an interoperability strategy aligned at international level will be key for faster development of digital health that would improve the patient outcomes in a safe manner. All information about patient health, including information collected during patient interviews, diagnostic activities, treatment delivery, monitoring health parameters, questionnaires, etc., should be the property of the patient and should be available to the patient and anyone authorized by the patient in any of the systems where such data is collected. Patients' medical data is very sensitive data, so it should be very well secured. Access to patient data is a particularly important aspect of coordinated healthcare. It is important to create standards of anonymization and pseudonymization where exchanging patient data, which will preserve their privacy. Each interested party should have access to anonymous data sets for concept testing and research. So to sum it all up, I leave you here with the closing points. And if you ask me who would be successful as a player on the healthcare pharma market in the future, I believe that the winning player will be the one who best understands the patient journey, adjusts its business model into patient centricity, and actively supports it by cooperation through partnerships. Thank you all for today, and I wish you all a great time during this event and a lot of fruitful discussion. See you on the next forum, Zdrowia, next year. Thank you very much.
Thank you for that introduction, especially for emphasizing the patient-centric approach in the modern world, because this seems to be the key in the process of implementing digital solutions as they serve the patients, and emphasizing the new dimension of prevention leads us to a new way of managing the public services. Now I give the floor to the next speaker. It will be Kazimierz Cieńczak of Comarch, one of the leaders in the medical IT, which is successful also outside Poland. A Polish company that has been successful on the European market, which fits very well with the demands of patients, users, specialists, and then brings that experience back to Poland, which is also a part and parcel of the European continuum, which we're going to draw from heavily. Thank you very much. I'm very pleased to be able to participate at this great event, the eHealth Forum, as everybody else. I'm also sorry that this is in a virtual form, but I'm great. I feel happy nonetheless. I was asked as a Comarch representative to share with you our thoughts and our experience, our view on the priorities in digital healthcare. The three priorities that was set were discussed, but let me re-emphasize them because they're very important and give us a good roadmap. One should be an access to our medical data, not only in the region we are staying, but also the cross-border access to data should be guaranteed. Secondly, we've been thinking that it's absolutely necessary to have personalized medical services. If the data is part and parcel of the pan-European medical records, assures completeness of the data. And thirdly, empowerment. As patients, we need to be at the core of the public health, of the health system at large. So having those three priorities was a long way. I've spent more than 20 years in the business and the industry, and I saw many initiatives, grassroots and actually imposed, coming from various sources, including the European Union. And that also entails very big pressure on cross-border medical care. The rare disease reference networks are an excellent example of such collaboration. Many countries cope with the lack of such data, and thanks to additional financing, those systems have been implemented. Also, gaining knowledge by exchange of knowledge between experts and creation of the European Union for Health. This is what has led us to where we are now. And as Dr. Jankowski said during the previous session, our life and our journey consists not only of successes but also of failures. We should be mindful that when speaking about e-health, the more we move towards strategic thinking, the more we need corroboration that e-health is beneficial, brings benefits, and the organizational and other dimensions. A few words on our company. As a health-focused company, we operate on 7 markets. Our company is present in the 34 countries, and our clients turn to Comarch to supply for them tailor-made solutions in the health sector. We've been busy developing a world, or rather European, strategy, since we not only have coders, developers, code developers, but also a medical center and a laboratory in which we design medical systems. Every solution that is launched on the consumer market has been tested and enriched with features using those 3 components of our center. Focus on the patient centricity, using data that are produced in the HIS systems, medical records. This is it has been at the core of our activities for years, allowing us to reach the point where we are today and allowing us to cooperate with our clients in Poland and in Europe, including provisioning of medical service to end user. We capitalize on our experience. We are able to furnish comprehensive solutions in all the areas that showed on the previous slide. Systems for data capture and analysis. They operate regional platforms as well. So the solutions that are interoperational are what we can offer. As operator, we also provide medical service. And our strategic plan calls for this service being expanded outside Poland. And we implement the fragments or the parts of this network in a consistent environment. Another thing that we identified as very needed for learning from successes, B, learning from failures, are paths for assessing clinical tests. Several standards emerged that have become acceptable in Poland. We offer electronic e-health passport, so to speak, where you can collect your own medical records to find out about your health and make this data available to other doctors who may not use our systems. So the strategy has been adopted later by the European Union. To summarize what I said, it is of critical importance to define the points, the touch points and the strategy, so as to enable us as a European society to know where we're going to. Also, as part of our European activities, we are looking at variety. There are different levels of progress in utilizing telemedical and e-health solutions. Notions are defined differently. As part of Horizon 2020, we participate in a project where various European countries told us how they understand health, and these definitions were different. Also, approach to storage of medical data. Although we are all members of the European Union, various countries have variously stringent measures for data storage. And we need to be aware of those challenges, because in many areas we create silos and islands, and data is stored and not passed to the others. Islands are great projects that are performed but never followed up on. And we don't use the solutions that are available, and we keep on looking for new ones. This is also something that inhibits us.
No, troszeczkę teraz osłabiony, ale jednak występuje, czyli brak publicznego płatnika. Podsumowując, bardzo się cieszę, że mamy ustalony ten drogowskaz, wiemy, w którą stronę iść i zdrowie cyfrowe w Europie jest takim elementem, bez którego przyznaję, że nie wyobrażam sobie dalszej podróży w tym systemie. Bardzo dziękuję.
Bardzo dziękujemy. To był praktyczny komentarz do owego.
It was a very practical commentary to the European dimension of this framework. We know where we are headed. We know where we as Europe are going. And the next presentation will be exactly tackling this point, how we are formulating our policies. Robert Moudach, an expert in European funds, in European issues, he will touch on allocations which reflect those priorities, and later this will be followed by discussion. Thank you very much for discussing, for extending the invitation to me. E-Health Forum is the place where we are discussing new technologies. I'm going to show you a handful of slides from the perspective that we have addressed today, the perspective of Europe, the perspective of the European Commission or specific directorates of the European Union on the digital health priority, the priority related to e-health. If we went back before the pandemic, strategic priorities of Commissioner Triatides of DG Sante are not a surprise to us. We know them. Just to jog your memory, it's access to medicine, certain regulations related to medical devices and medicinal products, communication on vaccination, the Europe's Beating Cancer Plan, and health issues, e-health issues. So let me read them out in original. The pandemic has only reinforced those priorities which were written into the strategic document. So, in other words, high-quality healthcare and something what is very important from the perspective of very different priorities of the Commission and European community, reducing inequalities. So this is something, because a lot's been said about e-health as a tool that is meant to boost standards of healthcare and help us face different challenges, and we are seldom discussing e-health as a tool for reducing inequalities in healthcare or regional inequalities, differences between rural and urban areas, or social inequalities, because different social groups do not have equal access to healthcare, and e-health is very clearly written into these priorities. But after September 2019, something has visibly changed. And this is a very important political declaration made on the 11th of November this year on establishment of the European Health Union. It's true that despite the fact that health is not an area covered by the treaty, this is the competence of member states, but health, especially in the face of risk, is interpreted differently, and so is the role of the European Commission. It is no longer perceived in the old way, to quote Madame von der Leyen.
Union to protect citizens with high quality care in crisis and equip the Union with its member states to prevent and manage health emergencies that affect the whole of Europe. Z powodu traktatu ten język.
Because of the treaty, this language is mainly focusing on measures forced by the crisis resulting from the overall situation, what means that our national health competencies remain national, but the EU is playing a more pronounced role. So this is a bypass of treaty regulations, but the name itself, the European Health Union, signals a major change. European health data space, well, to be frank, you're right, because ever since the 90s we've been discussing it, but before we used to discuss it in the context of statistics, transborder care, and today the context has become much wider, especially after the 11th of November. This common European health data space results from declarations on the European Health Union, and early this year, before the pandemic, data strategy was published, the new freedom we are building within the EU. So we are not only going to guarantee the freedom of movement, some services, but we will also ensure freedom of data. The German presidency, teamed up with the European Commission, have declared very close cooperation, so work closely together on European data space. So we have political priorities and we have technological tools to execute on them. So what are we planning within the EU? By 2025, we want to fully ensure transborder access and interoperability of medical data. And also by 2025, we want to enable patients from all member states to share their data anytime and anywhere in the world, because they are abroad, or perhaps we need to have second opinion, or perhaps we are benefiting from competency centers that have been mentioned before. But I'd like to highlight is the role of the third objective, which should be implemented starting next year, Data Governance Act, the new regulation that will govern exchange of information and will strengthen and extend the use and reuse of health data, not only in the context of their use by physicians within healthcare, but also reuse for such purposes like innovation, competitive and resilient development in Europe. So reuse of health data is a great opportunity on one hand, and on the other, the need to work harder to make sure that patients feel safer, that they have a sense that there is transparency concerning the use of their data, which is why the Data Governance Act is essential. It's a gateway that will safely enable us to safely use the data. There are some doubts concerning how medical data should be used and how to ensure their reuse, which is compliant with their sensitive nature.
And the final slide on the funds. We are amidst the discussion of funds, about funds. But all the activities that I spoke of have been financed from EU4Health, but also from innovation programs such as Horizon Europe or Digital Europe. And they will probably finance, or quite certainly be financed, from other programs that will be continued in the MFF 21-27 Resilience Facility, Regional Development Fund, and European Social Fund. So that's a great opportunity and a great political focus to develop e-health as part of the European joint data sphere. But on top of that, the organizational, technological, and social challenges that come on top that make this reuse of data a possibility will help us cope with the challenges that we are all facing in Europe. I think that it's a very long lead into the discussion, and I thank you for listening. Thank you, Robert. It was not only long, but first and foremost very topical and very important because you indicated the priorities of the German presidency, which has been comprehensively, consistently introduced, modernizing and putting certain things into practice of Europe. Now I give the floor to Paweł Majndok, President or CEO of Aqua Healthcare in Poland, to give us more info on the European perspective from the viewpoint of a European company. By way of introduction, 2 years ago we hosted Aqua with their contribution on population health management. I believe it's possible to revisit the slides and conclude how very forward-looking those slides were, how important this message was about what health management of the population would be about, and that we changed our definition of what we used data for, namely for better healthcare aimed at alleviating the differences in the health status of individuals. So this is the current direction. Please tell us about your perspective of a European company. What is your outlook? What's your take on this? Well, thank you very much for inviting us and for previous speakers' contributions. That was very inspiring and offered an excellent introduction. As we spoke about e-health earlier on, I wanted also to hark back on the opportunities that both COVID and pandemic at large offered us in the area of medical and healthcare sector in Poland and in Europe. I also want to hark back to the previous conferences where we had several times voices from various areas, patients, technology companies, hospital directors, to the effect that the technologies in medicine actually lag behind those which are implemented in other areas such as banking or office technology. Today, however, the COVID pandemic, as our Israeli guest aptly put it, enforced on us a rapid acceleration of the transformation of those technologies. Acceleration of implementation of those technologies into the sector, into the medical sector. We spoke about interoperability and early adoption of tools. Some of them may be far from perfect. Applications don't work everywhere too, but it's a great technology opportunity and challenge at the same time for looking forward. As far as the European take is concerned, I wanted to share a rather negative thought, but given what Robert said, I would call it a positive message, because it's better to speak about positives and negatives. From the European point of view, the pandemic demonstrated how much decentralized approach to health we all have. This is what Robert said, quoting treaties. Today, however, technology would allow us to do much more than what we had achieved before. In the US, there is an epidemic data gathering or collection system that allows to identify the outbreak of an epidemic earlier on. If we had the system, if we had the system in Europe, we would have identified and basically pacified the first onslaught of the pandemic early on at this stage of first infections. So this is the new revolution that Bill Gates announced and which will inevitably visit us too. So the opportunity arising out of this pandemic will be that the next pandemic will be managed at a pan-European level. Instead of closing the borders and instead of focusing on pandemic management, each and every country for itself, we would manage the whole of Europe. This is how we work as a continent. Our citizens travel between countries, they travel distances, and we need to manage health also at a pan-European level. Interoperability is very important, of course, how to collect the data and process them later. As ACFA, we work more with the doctors than we work with patients. And we were also confronted a great transformation that evoked the need to change the way how we share data, especially X-ray and MRI data, and also to send data remotely for diagnosis, also between hospitals, because the resources were limited locally, also during the first phase. Tomorrow at the panel, I will speak about how the office technologies assess the medical sector and the doctors to diagnose sicknesses early on and start treatment. So undoubtedly, the COVID pandemic accelerated application of certain technologies in medicine, but also showed how many opportunities we still have in front of the European Union and us all in terms of diagnosing, identifying early cases and treating them later. How many opportunities we still or are still laying ahead of us, and how we can utilize those technologies to full. I think the topic is very broad. We can talk about this for days on end. Thank you. I think we have conducted this dialogue directly at a panel, alas, not this year. So there's definitely an opportunity for us. Kazimierz, could you please tell us in 30 seconds if that really is an opportunity? Do you perceive your presence in Europe also as an opportunity for your business? As a company that is very innovative, generates a generous return on investment, what is your take on the European trends? Indeed, I received 30 seconds. We do perceive it as an opportunity, most definitely. If we had a different take, we wouldn't have actually involved ourselves in all that. Why? In the reality, before pandemics, we were able to implement certain things earlier on in Europe than in Poland, than we did in Poland. And we identify the needs of the client and of the market first, as the clients abroad are more aware of their own needs and their possibilities offered by the technology. We also look towards China and US, because in those countries health is very heavily used. Thank you. So we keep our fingers crossed and we congratulate you on the past achievements, because it seems that Polish solution can also be made global. Robert, quick question, quick answer, 30 seconds, please. Is Poland prepared for adoption of the European programs, the billions that were allocated? Are we prepared in terms of institutions, mental approach, and also leadership? That's a difficult question. I would say yes, we are prepared and we would gladly receive those means. But the question is always to what extent those funds should be used for utilization and to what extent for transformation. I think we are at the eve of such a debate. To what extent these means will serve supplementation, transformation. I think that in a point in time where those resources should help us to get out of the pandemic, they should be geared towards transformation. But we have so many financial problems, so supplementation used to prevail, actually plugging the holes rather than transforming the system. I wish it would be different this time. So it seems that transformation has been used as a word many times during the eHealth forum. We indicate the pressing need to use those available resources for transformation to change the trajectory and things, or use the funds to actually bridge the gap, fill up the gap, and move towards other areas of growth. One more statement. Confronted with a change, supplementation of transformation, I would rather want these funds to be available anyway. Let's stick to the European values anyway. Right, Ladies and gentlemen, thank you very much. I think we will continue the debate in the next parts of the forum and also in the public debate. Thank you very much.